Have you ever found yourself clutching a dense medical pamphlet after a doctor's appointment? Or maybe just staring blankly at discharge instructions after, say, physical therapy, feeling a bit lost? It's often full of words you barely recognize, sentences that just kind of go on and on. It really makes you wonder, how much of this vital health information are we actually understanding, especially when it's, written down like that? Today on the deep dive, we're going to peel back the layers on something really fundamental, but often overlooked in healthcare. We're talking about health literacy and the readability of all those patient education materials. It's really about making sure that the critical info you need, well, that it actually makes sense to you.
That's a perfect way to put it, because health literacy, it's so much more than just reading. It's officially defined as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And honestly, its impact, both on people individually and the whole healthcare system, it's just profoundly underestimated.
So our mission today is to explore this recent, pretty fascinating study. It zoomed right in on physical therapy materials. But trust us, the insights we're going to talk about, they really stretch across, well, pretty much every medical field. We want to get to the bottom of why clarity matters so much, what the big challenges are right now, and importantly, how providers are trying to bridge that information gap for you, the patient. And yeah, some of the initial findings about how tough these materials currently are, genuinely eye-opening.
Oh, absolutely. It really is quite sobering when you look at the scale of the problem. Think back to 2003, the National Assessment of Adult Literacy Survey. It found that a staggering 88% of U.S. adults lacked proficient skills, lacked the skills needed to really comprehend even basic health information. I mean, think about that. The vast majority of people are, in essence, struggling to understand what should be fundamental guidance for their health.
Wow, 88% lacking proficiency, only 12% proficient. That's startling. It immediately makes you ask, okay, if so few truly get it, what does that mean for the average person just trying to make good health choices? What are the real world consequences of that? For individuals, sure, but also for the system as a whole.
The ripple effects are just immense. We see direct links to increased healthcare costs, for one, higher rates of preventable chronic diseases, too, because people aren't managing them effectively, more emergency room visits, less preventative care happening, like crucial screenings or shots. And it also leads to people not sticking to their treatments as well. I mean, if you don't fully grasp the instructions, how can you follow them right? And understandably, it leads to more patient dissatisfaction with their whole care experience. It's like trying to navigate a maze blindfolded, really. And just to give you some context here, the average reading level of U.S. adults, it falls somewhere between the 6th and 8th grades. So considering that reality, major health organizations like the NIH and the CDC, they've put out very clear recommendations. They say patient education materials should ideally be written at or below the 6th grade level, or, at the absolute most, the 8th grade level. And that's not just some random number. It's picked because it reflects the average reading ability, meaning materials at that level should be accessible to most people.
Okay, so if the average person reads at, let's say, the 7th grade level, give or take, how do we figure out if a medical pamphlet actually hits that target? That's where these readability formulas come in, right? Like the cleverly named SMO, simple measure of gobbledygook. So SMO is like a specialized reading test for health stuff. It basically counts, syllables and long words and looks at sentence length?
Exactly. It looks at words with 3 or more syllables in sentence length. And the idea is if a document scores at, say, a 6th grade level on SMO, it means pretty much everyone reading at a 6th grade level or higher should understand almost all of it.
Like 90 to 100% comprehension.
That's the goal, yeah. It's about creating that common ground for understanding. But what's really fascinating, and frankly a bit concerning, is that this isn't just a physical therapy problem. Not at all. We see evidence from all across medicine, urogynecology, genetics, radiology, oncology, cardiac rehab, you name it. It consistently shows that patient materials are overwhelmingly written above those recommended reading levels. Just as one example, a major review found nearly 90% of materials from really high-impact medical journals were written at or above the 8th grade level.
90%? Wow.
Yeah, it's not an isolated thing. It's really a systemic challenge across healthcare.
Okay, so given this widespread issue, one team decided to, put it to the test in a real-world setting. And that brings us to the study we're focusing on today. They looked specifically at 38 printed patient education handouts. These were from the physical therapy department of a large hospital system, somewhere in the Midwest, a suburban area. They just wanted to see concretely how readable are these everyday documents that patients are getting.
And the initial findings, they painted a very clear and honestly quite stark picture. The original documents, before any changes, had a mean reading level of 10.97, so almost 11th grade.
11th grade. For the average.
For the average, yes. And even more astonishing, the range went all the way up to an 18th grade level for some of them.
18th grade, that's like postgraduate level.
Pretty much. And a striking 78.95%, nearly 80% were above that recommended 8th grade level. So it really confirmed the researchers' initial suspicion. These materials were just far too complex for the average patient.
Okay, now here's where it gets really interesting, I think. The researchers didn't just stop at identifying the problem. They actively tried to fix it. They tested 3 different ways to modify the materials to make them easier to read. First was something called word exclusion, or WE. Basically, they just took out multi-syllable words if there wasn't a simple replacement, like maybe avoiding the term physical therapy itself sometimes. Second was word revision, WR. That's where they swapped longer, complex words for shorter, simpler ones. The example they gave was changing oncologist to cancer doctor. Makes sense.
Right. Much clearer.
And then third, a combined approach, WHERE, which, just used both strategies together.
And the results of doing that, they were incredibly insightful. So while all 3 methods did lead to a statistically significant decrease in reading level, meaning they definitely made the materials easier to read.
Okay, so they all worked to some extent.
They did. But only the combined word exclusion and revision method, the WHERE one, brought the average reading level down to 8.42. Now, what's crucial here is that this 8.42 level is not statistically significantly higher than the 8th grade target.
So it basically met the upper recommendation, statistically speaking.
Exactly, which is a huge step forward, right?
Yeah.
Getting it down from almost 11th grade to meet that 8th grade ceiling. However, it was still significantly higher than the ideal 6th grade level.
I see. So progress, definitely, but maybe not all the way there for maximum accessibility.
Precisely. It shows that while these targeted changes can improve things dramatically, reaching that optimal level for the broadest audience, it's still a persistent challenge.
So what does all this mean for us then? For patients trying to understand their health, it really seems to underscore that just, tweaking words on a page, while definitely helpful, isn't the entire solution. It's not the magic bullet for bridging that comprehension gap. There's be other really vital strategies we need to think about for genuinely improving patient understanding.
Exactly right. We need to sort of broaden our focus beyond just those readability formulas. We need to consider the overall suitability of the materials. There are tools for this, like the Suitability Assessment of Materials, or SAM. SAM goes much deeper. It looks at 6 different dimensions. The actual content, sure, but also the literacy demand, how effective any graphics are, the layout and design, elements that help with learning and motivation, and importantly, cultural appropriateness, too.
Okay, so it's much more holistic than just counting syllables.
Much more. Now, it takes longer, maybe 30 to 45 minutes per document compared to a quick SMOJ check, but it gives you a far richer picture of how well those materials actually connect with people. It's about the whole package, how it's received, not just the words themselves.
And critically, it's not just about what's on paper, is it? The human interaction part seems massive and maybe often overlooked, like healthcare providers actually explaining unfamiliar terms verbally. That seems key.
Absolutely vital.
But also maybe being tuned in to nonverbal cues. The study mentioned things like red flag behaviors. Like, is the patient avoiding eye contact when you're giving instructions? Do they just nod quickly without asking questions? Or maybe they take forms home to read later instead of looking at them there.
Right. Those aren't necessarily signs of rudeness. They can often be subtle signals that there's a comprehension gap, that something's not landing.
So sometimes maybe tailoring the materials or even bringing family or caregivers into the conversation, that might be what's needed.
Definitely. Individualizing the approach is often necessary for true understanding. And this brings up a really important point. What about the education for healthcare professionals themselves? We need to ensure that doctors, nurses, therapists, everyone are properly trained in health literacy assessment and also trained in the practical skills of modifying patient materials. That's crucial, because that's what empowers the providers to then truly empower their patients, making sure the information shared isn't just handed over, but genuinely understood.
So it's pretty clear, isn't it? Poor health literacy is this significant, widespread issue. It's deeply impacting healthcare quality, costs, everything, right across the board. But this deep dive, it really does offer a clear, sort of actionable path towards making things significantly better. And it starts with making information much more accessible.
Absolutely. I think the key takeaway here is that improving those written education materials, that's a vital first step. It really is. But for true success, it really needs to be combined synergistically with a whole host of other communication methods. We're talking about clear verbal instruction, practical demonstrations where needed, and even using modern tools like videos or audio recordings to really break down those comprehension barriers and make sure the message truly gets through effectively.
So maybe the next time you leave a healthcare visit, just take a moment. Really consider how clear and accessible all the information you receive truly felt. What questions could you maybe ask next time? Or what might you look for to feel more confident that you're truly well informed about your own health journey? And just, imagine the incredible ripple effect. If healthcare consistently delivered information at a level everyone could easily understand, not just a few, but every single person, what would that look like?